Every year, Global Wellness Day highlights the importance of living well. It is observed under the slogan, "One day can change your whole life." This year, with the start of the National Health Insurance's Disease Management and Wellness Program, the NHI team will host a walk relay for Global Wellness Day and officially launch the program. For the Ministry of Health and Social Development and the Department of Information and Public Relations, I'm Adriana Savarall, your host for this GIS report. Joining me today is Dr. Harlan Vanterpool, a representative from the NHI's Wellness Program. Thank you for being here, Dr. Vanterpool.
Thank you, Ms. Savarall.
So let's just go straight into it. What is your role in this program?
Well, the Disease Management and Wellness Program that the NHI is launching on the 9th of June. I'm currently the coordinator for the program, and I'm also medical director at the National Health Insurance. So it is my role to make sure that the program is basically well coordinated and that the efforts that we're making to really promote disease management and wellness in the territory are constantly supported and managed accordingly.
So when you say disease management, will that include bringing in other agencies or partners on board?
Yes, we envision, of course, that the disease management and wellness program would basically be a long-term program. And over the years, we expect and we are certain that we will be partnering with a number of agencies to promote health, including nonprofit organizations, government agencies, any entity that is promoting disease management and wellness in the territory, which certainly will be partnering with. Yeah.
So what do you expect from the public and their participation in order for it to be successful?
Well, my expectations from the general public is that as many persons will participate and eventually see where we can change disease or attitudes towards health in general. Really, the Disease Management and Wellness Program wants to change the way in which healthcare is viewed in the territory and wellness and the whole well-being around.
So it's like a conversation between the public and the program and other entities involved.
Yes, of course, of course.
So is this something strategic that is being launched on Global Wellness Day?
Yes.
What does that day mean for the territory as well?
Well, traditionally there have not been any celebrations around Global Wellness Day within the territory. And as you can see, wellness is a major part of the disease management and wellness program. So we thought it would be fitting for it to be launched on that particular day and carry that team throughout. That's a team that we're going to be building around for the disease management and wellness program. Our actual slogan is be happy, be healthy. And that's going to be our long-term mantra going forward.
So there's another theme or slogan that says, "One day can change your whole life."
Yes.
How can persons apply that to their everyday lifestyle or routines?
Basically, that's telling you that lifestyle changes in health, you have to take it on a daily basis. We don't expect you to suddenly, if you were somebody with living in an unhealthy lifestyle, to change that overnight. But you have to say, at some point, take stock and say, I'm starting, I want to change my lifestyle from this day forward. So as you can see, one day can change your life. If you made a commitment to living a healthier lifestyle, and you're willing to go forward with it, that's what's going to happen. But it has to start by you making a commitment and say, hey, I need to live a healthier lifestyle because I want to live a happier, more fulfilling life, and of course remain active and be able to enjoy at the highest level as possible.
Now, how do you convince someone who maybe they know they're living an unhealthy lifestyle, but they still just don't have that push, that incentive to get up and do something about it? What would be your recommendation?
Yeah.
Or how can you encourage them to start?
Yes. Well, one of the things that I'm privy to as a physician is the understanding that diseases and bad health outcomes, that doesn't matter on age, gender, anything like that. I'm seeing persons in their 30s with terminal diagnoses. I'm seeing persons in their 70s that are living a full, healthy, normal life, never had hypertension, never had diabetes, and no chronic diseases. So basically, it's all about the way that we live our lives, the way that we manage our diseases when we do have diseases, because obviously some persons are living quite long with an extended life and a normal life with chronic diseases. There are persons that are hypertensive that are living over 100 years old in this community. So it has to do with the way that we're going to take control and stock up our individual lives and our attitudes towards health and wellness in general.
I'm going to throw in this question here. What would be your response to someone who asks, well, why NHI is taking the lead on this?
Well, the simple answer to that question is this. The National Health Insurance is responsible for every person that resides in the territory legally. Whether you're a baby, infant, or elderly retired person, in some way or the other, the NHI is either providing the avenue for access to health care, or it is something that's we're all contributing to in some way, shape, or form. And therefore, the NHI has to be cognizant of that we need to ensure that long-term sustainability is encouraged, and also that we're serving a population that is getting healthier over time, not the opposite, right? And we see that promoting health and wellness is a major, major part of improving our health outcomes, improving our attitude towards healthcare in general. So we need to have a paradigm shift in the way that we think and act towards healthcare. So I think it's correct place to have some emphasis by the National Health Insurance, among many other entities in the country. But that's why we see this important.
So by you saying shifting our attitudes, what are, in your experience as a physician, even if you can, what has been the norm towards disease management or wellness in the territory?
Well,
or just simply exercise?
Yeah. In general, a lot of us, we know someone with high blood pressure or diabetes, whether in our family or outside them. Every one of us must know somebody with a chronic disease or in general. And by the way, I'd like to point out that obesity is considered a chronic disease now. So in that, it's, and it must be that when we see these attitudes and the way that we're addressing them, that we need to correct and change that.
What's the norm attitude towards exercise?
Okay. Well, what we find is generally persons' attitudes towards exercise and the right diet only changes after they've been diagnosed with a chronic disease,
reactive,
or the doctor says, if you don't do this, this is what's going to happen. You're heading down a road for early death, that kind of stuff. So a lot of persons are scared into doing the changes that are necessary. But you don't want that to happen, because oftentimes when you're at that point, you already have the active disease and you're just managing that disease at that particular time. We're particularly concerned to prevent persons from becoming diabetic and hypertensive from early on by taking charge and living a healthier lifestyle from early on. So even if you're plagued with hypertension and diabetes and that kind of stuff later on in life, at least you're already living a healthy lifestyle, and you're going to probably live your full normal life with that particular disease with no problem.
Yeah, I think persons, so this is more based on being proactive
Yes,
rather
of
than
course.
reactive.
Yes, absolutely.
So we're going to go straight into the event on June 9th. There is a walk relay. It's scheduled for 6 a.m. or 6:30, correct me.
It's a walk relay that starts at 5 a.m.
Oh,
And
even
launch-
earlier. Okay, so
And the official launch is at 6:30 p.m.
okay,
Yes.
6:30 p.m.
6:30 a.m. Sorry.
Because I was like,
So
oh,
wrong,
6:30 p.m.
yes.
Okay, so tell us more about that event. What should persons expect?
Okay. So basically, on the morning of Saturday, June 9th, we will be at the QE2 Park officially from 4:15 a.m. With the registration process for those that have not pre-registered. You can pre-register for the event by sending your team or your name to April Glasgow that's aglasgow@vinhi.com via email. And she will give you a response and officially register you that way. If you have not done that, you can come anywhere between 4:15 and 5 a.m. and be registered for the walk relay, which starts promptly at 5 a.m.
So tell us more about the walk relay. I know there's some stops involved.
Yes.
Do you have some giveaways?
Yes.
What can persons look forward to by participating?
So what's going to happen is that we've decided to do a walk relay that takes us around Road Town. And part of it is going to be up past the hospital, up into the hills of McNamara, and come back around, meeting at Paul Watley Road, go around by the Methodist Burial Ground, past the Sunny Mountain Well, up into Botanic Station, takes us right around by the police station, brings us around by the recreation grounds and the Festival Village site, and come back straight down on Waterfront Drive into Queen Elizabeth II Park. That's where we would end the walk relay. And basically what we thought was that we would allow persons to encourage as many persons to come out is to do 4-part teams, or persons can walk the whole entire route as an individual as well. We're going to have prizes for different categories, best dressed team, that kind of stuff.
A walker.
First walker to complete individual, a number of challenges, and even for those who may not be able to walk the entire route, and when we get to the Queen Elizabeth II Park, we'll be doing a 10,000 step walk challenge within the park itself.
Okay.
So there's going to be opportunities for young, old, doesn't matter who. We're trying to encourage everybody to come out and start your lifestyle change on this day, Saturday, June 9th. We want to encourage persons to exercise daily and use it as a personal challenge to change your lifestyle. Live a healthier, be happy, be healthy, you.
So this is the first of many events, I'm hoping.
Yes, that's the plan, but it's the signature event, as it were. But we will certainly have a number of follow-up events, including plans to do something in disease management and wellness at each major inhabited island. Just Van Dyke, Virgin Gorda, and Antigua.
That was my next question. Yeah,
Yes,
so
because this is a national program, we have to be inclusive of every single individual within the territory. So there'll be different things that we're doing. Yeah,
Okay.
definitely. And the plan is to continue to recognize Global Wellness Day in this way on an annual basis. So there will be at least a major event on June 9th going forward. That's the
Going
plan.
forward
Yeah.
as an annual event. Well, is there anything else you'd like to add as we bring our interview to a close?
Sure. I would like to encourage us to come out in droves, support the disease management and wellness program. Actually, the next phase after the launch is to complete our health risk assessments.
Okay.
Okay,
So what does that mean?
Okay, so the health risk assessment, it's a questionnaire that's designed to basically look at each individual and categorize their health risks into high, medium, or low risk. A high risk individual is going to be somebody that's just on the verge of obtaining a chronic disease or already has a chronic disease that they're grappling with or managing.
Okay.
A medium risk person are those persons with several risk factors for developing a chronic disease, whether they're pre-diabetic, whether they have a strong family history of diabetes and they're not exercising regularly, they're not eating right, they're overweight, etc., etc. And low risk is for that individual that generally is not necessarily paying a lot of attention to their health, but their risks for developing a chronic disease at a particular time is relatively low. Their BMI is at very normal, body mass index. They're exercising regularly, that type of thing. They take charge of and they live in a healthy lifestyle. So those persons are at lower risk from developing. And basically, each individual will have the opportunity to fill out that questionnaire online. That's what we're going to be doing it, that you can access it through our website.
Okay.
And there's going to be some incentives for you to do all persons that enter and fill out the questionnaire would be eligible to go in a raffle, and it's going to be a prize that's worthwhile.
Let's be clear, this is after June 9th?
Yes.
Okay.
Yes. So this is after June 9th. The website will be going live at that point. Okay. And we'll actually have an official launch of the health risk assessment and letting the public know that they now can go online and sign up and complete the questionnaire. The other thing is that the questionnaire is going to be able to calculate the risk and give you immediate feedback as to what your risk is.
Okay.
And that will be followed by, if you're a high-risk person, automatically you will receive a response email, and we're going to be guiding you on what steps you should take, on how we think that you should be managed, etc.
Okay.
Also, if you're medium or low risk, we're going to be creating programs to support and encourage and foster disease management and wellness period. So there's a lot of plans around what we're going to do based on the health risk assessments. It's very important that we get all individuals to do the health risk assessments for a number of reasons. Hopefully our aim is to have the largest evaluation or risk assessment of health within the territory that has ever happened. And of course, being able to make decisions on health and wellness and so forth relies on data.
Yep.
And so we're hoping to be able to gather the most comprehensive data that we've had on health and health risks in the territory. And I think that once we've analyzed this data, then we can certainly be more proactive in the way that we approach and develop programs in the territory, all aimed at improving our health.
For more information on Global Wellness Day on June 9th, contact the National Health Insurance at 852-7800, or you can call 541-9102. You can email April Glasgow at aglasgow@vinhi.vg or hvanterpool@vinhi.vg. To access this report and other government news via web, please like us on Facebook at the Government of the Virgin Islands or subscribe to us on YouTube. For the Ministry of Health and Social Development and the Department of Information and Public Relations, I've been your host, Adriana Savaral. Until next time, thank you for tuning in.